If it hurts there when you do stuff like this, then you've probably got tennis elbow or lateral epicondylgia, as it's technically known. But pain on the outside of the elbow, worse when you grip things. It is a brilliant condition to treat with focal vibration. We've got lots going on around here. We can have some joint-based soreness, we can have some neural pain, and then we've got this common extensor tendon where all of the muscles of the hand and the forearm that pull the hand into a star shape attach onto the bone. So it's a real kind of bottleneck in the body where there's nerves trying to get through, muscles trying to attach, and joints trying to create complex three-dimensional movement. So the first thing you want to know is some kind of test that makes it sore, so you can see whether you're doing yourself any good. Great tests to use are gripping in a straight arm position. If you've got sore elbow, this will often be really sore when you squeeze. If it feels all right like that, try dropping your hand down into wrist extension and squeezing again in that position, and that will often bring on a little bit of pain. And then the other thing you can use as your test is basically just picking up a weight in a knuckle down position, and again that will often hurt you through here. So if those things are painful, then and you can feel some soreness when you poke around this area, then we want to get in there and treat with our TEND. The focus is brilliant for this area with its ultra fine point. We really can be more precise than with any other tool. So this is the area that we're targeting, where these muscles come on and attach up onto the bone here. So most people have identified the sorest spot of the bone. That in and of itself we kind of want to leave alone, and you're interested in looking up in the outer forearm to see where there's any tenderness deeper down as it runs down towards that obvious bony spot of pain. And a lot of people will be able to pick up the soreness on touch up here that they don't necessarily feel when they grip and lift. So clearing out above the sore spot, super good idea through here. Key thing to remember with TEND is you don't always get more by pushing in. Lots of our pain sensitive nerve endings are just below the skin, and so lighter pressure will often feel more tender. You kind of want to move through the area that is most painful and at the depth that feels the most tender, sort of thing. So don't push it in too hard, you might be missing what's actually sore. And then giving the bone a little bit of a wide berth, because right on the point of the bone there it tends to just hurt. I want to come to the other side and start following all the little gullies and gutters of the muscles that run down towards the back of the hand. And as I pass the TEND through there, I'll often be able to identify really sharply sore areas in there. And when we find one of them, it's a great idea to think of just sticking to the skin and gently separating the layers of tissue underneath. So I'm trying to wiggle the gaps free between all the different muscles, nerves, tendons that run down from that outer elbow towards the forearm. So a kind of wiggling line moving down, looking for tender spots going through. When I've cleared out one gully, I can come round to a slightly different point, find another line to follow down and move down through those points there. So really nice ways to treat down through there using the point. We can also then turn onto the side and use the curve of the treatment head to allow us to just come down and cover a much bigger surface area. And this is where we can recruit a bit of motion to what we're doing, lifting the hand up and extending the fingers, dropping the hand down and curling the fingers. So as I massage through the area and treat those sore spots with the TEND, I'm also creating maximal excursion within those muscle tendon units as the fingers go from this hand up, fingers extended position to this hand down, fingers bent position. That ensures I'm creating kind of maximum mobility within the tissue. And be prepared to treat all the way down to the back of the wrist. Some people it'll continue to be sore all the way down towards the thumb. Other people it'll go more towards the little finger side. But wherever your soreness goes, you follow it down through there. Now, the other thing with tennis elbow is or lateral elbow pain is to remember that often part of what's driving it is just how tight we are in the wrist flexors. So where we're dealing with truly tight tissue like we often have through here, it's a nice idea to think about putting the tissue onto stretch. So I can do that like this, or I can just use the floor to pull the fingertips back. So I'm making sure the elbow's nice and straight and the hands on stretch. So these muscles here are already under tension, and then I'm going to come through with the 10 and do some slightly firmer strokes down into this. So I'm not looking to necessarily reduce sensitivity because this isn't where I'm sore, but I'm looking to help the muscles and the tendons to relax to allow better length on this side. And generally this is an area where most human beings are really short. If you do lots of gripping activities, you can almost guarantee this tightness is part of what makes you get sore around the back. So firmer pressure and treating along the direction of the muscle with it on stretch is how we can kind of maximize the potential for vibration to help us to lengthen. So self-treatment, that stuff's all really great. An awful lot of elbow pain, particularly the more chronic and recurrent lateral elbow pains, will have a significant component coming from the radial nerve, which has to pass directly through this area here. So to glide your radial nerve, what you're going to do is put all your fingertips together, bend your wrist, take that shaped hand, don't lose the tension in the hand, turn it inside out like so, stick the neck away, and then with the shoulder staying nice and low, I'm going to extend out like so and pulse into that nervy stretch type feeling and just pulse, pulse, pulse into tension 15 to 20 times. And then that's another great way to relieve pain on top of that soft tissue work we've just shown you. And then the more long-term thing we want to do is add some strength to these muscles through here. So a really easy way to do that is just to grab a couple of kilos worth of weight, find somewhere to rest your arm into support like here, and then from there I'm going to practice curling the hand up and slowly dropping down. And as I do this, I'm mindful to try and keep all fingers gripping as the weight comes up and then dropping back down again. Best way to do your strengthening exercises is comfortably. So if it really hurts when the weight drops down, then don't drop it quite so far. If it hurts and pulls as the weight comes up, just work in the zone that you can do where you're creating more fatigue than you are pain, and that way you can be reassured that the net result will be some strength gains. If you're too brave and you push into pain with strength work, you'll tend to just aggravate the system and not really make the gains you were hoping for. So then the last thing we can do is think about getting the elbow joint to move fully. Now we want to make sure we've got full bend up like so and full extension down. Elbow extension should just fall down like so. A lot of people will notice the shoulder tends to jerk instead of the elbow snapping home. So can you throw your elbows into extension if you can't work on that movement? And then the other one we can do is to put the hands on the floor and practice this circular motion. So I'm thinking of the crease of the elbow here. I want to twist that out the front as far as I can, and then I want to twist that towards the back as far as I can. I can compare lefts to right, and I can also look at my ability to do that when my arms are short and my shoulder blades are together, where my shoulder blades are kind of just in a mid position like so. And then final check is to push those shoulder blades as far apart as you can at the back, keeping that length to the arms. Do you still have the ability to circle those elbows equally and with good control? So they are some helpful, practical ways that you can start to get in and treat your own elbow. The soft tissue work with Attend is wonderful, but the exercises are what are going to change it on the medium to long term. So short-term relief comes from these lovely things we can do to ease the pain away, but the long-term relief comes from finding the right exercises that give you the inputs that your body needs to help it recover.